All right, so at Washington University School of Medicine in St. Louis, doctors are working to understand what causes people to itch. Patients at the Center for the Study of Itch suffer from debilitating chronic itch. In fact, estimates say up to 15% of the population suffers from it. Now, a new treatment discovered by researchers at the center is giving them hope by stopping that itch and improving people's quality of life. Now, here to tell us more about this condition, Dr. Jonathan Buttram, an allergist and immunologist with UT Health Northeast. Thanks for coming in and being with us.
Thank you very much for having me.
Of course. Now, first of all, I just got to ask you, what is chronic itch, and do we know what causes it?
So chronic itch can be several different types of diseases that cause it. And often we used to think of itching as just an allergic problem. And, histamine release would then interact with nerve cells and cause itching, and antihistamines would fix that. What we've learned over the last probably 20 years is that antihistamines are often ineffective, and what we're now understanding is that itching is a very complex interaction between the skin barrier itself, the immune system, and several different types of immune mediators and regulators, and the nervous system too. And what this recent study has demonstrated is that blocking certain immune functions can actually decrease itching.
So there's a lot of factors, clearly.
Exactly.
So what are some of the best ways you could treat maybe some itching, even if it's mild, just something like a home remedy?
Right, so probably the first step to treating itching is making sure your skin is as smooth as possible. And so keeping it nice and clean with very mild moisturizing soaps, and then using moisturizers to keep that barrier intact is probably the first step. After that, there are several over-the-counter type of treatments that you can use. Certainly kind of the mainstay in the past has always been antihistamines. Short-acting antihistamines like Benadryl, or long-acting antihistamines like Zyrtec, Claritin, Allegra. Often those are ineffective for some forms of itching, and if that's the case, you probably need to see your family physician. Lastly, often we will prescribe topical steroids, and those are available over the counter as well. You have to be somewhat cautious with those because depending on the form of itching and the reason behind it, sometimes steroids can actually make that a little worse.
I got you. Now, I even have a personal question. Sometimes for some reason when I get ready to go to sleep at night, I just start itching like crazy. And it's not happening until nighttime. What is with that?
So a lot of that is during the day you're distracted. You're interested in keeping up with what you're doing during the day rather than thinking about your itching. When you lay down at nighttime, everything calms down, then suddenly it becomes more of an issue simply because you don't have other things that are taking your mind away from it.
See? Now I know. Thanks so much for coming in, Doc.
You bet.
We really appreciate it.
Thank you very much.